Hi, in this video I'm going to be talking about headaches during breast cancer and its treatment. There are a host of reasons that people can get headaches when they're getting treated for breast cancer, whether it's you or someone you love. First of all is that sleep is disrupted because we're anxious, we're uncertain about things, our routine is disrupted, and that's a very common cause of tension headaches. If you have migraine headaches, you can see your migraines get a little bit worse. We can also get sinus headaches, as we can even without going through breast cancer and its treatment. These are the common things that we see in people undergoing treatment for breast cancer. If you want to learn more about your treatment options, visit Yerbba.com. So what can you do? Well, first of all, if you're on treatment for breast cancer, we generally don't stop hormonal therapy, or also called endocrine therapy, or chemotherapy, or radiation therapy, or immunotherapy because of headaches. These treatments are really important, and rather, we'd like to manage your headaches instead. If you've never had headaches before, it's something to let your medical team know about, that you're having headaches, but it's not surprising that you might have your first headache during cancer treatment. If you're used to having headaches, you might notice that they get worse. And that's in part due to changes in your hormone levels. So even if your tumor doesn't get treated with endocrine therapy or hormonal therapy, chemotherapy, if you're premenopausal, if you're still having periods, can alter your hormones. And as you probably know, alterations in hormone levels can lead to headaches. It's really quite common. Can chemotherapy itself, just even if you've already had your ovaries stop working or if you don't have ovaries, can that cause headaches? It can. Again, sleep disruption, change in your routine, but also there's a lot of tension. You might notice that the headache starts in the back of your neck, for example, and you might feel pain in your neck. Sinus headaches we see in the front of the face or the forehead, and this tends to be a feeling of fullness. Migraine headaches, if you haven't had one, I'll describe them for you. They tend to be one-sided, though they can then become two-sided. They can go to both sides. They can actually start in the back of the head as well. Some people get nausea with migraine headaches, and some people get vision changes. There are a whole host of different ways that migraines can present or show up. What can you do about headaches? As I mentioned, we don't like to stop your treatment because of headaches. We can certainly, if you come in for chemo one day and you're really suffering, we would postpone your chemo a little bit, but not much more than a couple days. We would treat the headaches with a few things I'll talk about in a moment, and then resume your treatment. Really important things you can do for yourself that don't have to do with medications include regular exercise. This doesn't have to be high intensity exercise, but a walk or a jog, whatever you find yourself able to do for about 20 minutes a day. You can actually break this up into several 10-minute walks if you want to, but trying to get outside. If you have a migraine, you might notice your eyes are sensitive to light, and that might not be the right thing to do, but daily exercise, again, it doesn't have to be high intensity. Ice to the area that hurts for a migraine, the back of the neck or the forehead. If you're having a sinus headache, you can also put ice on the areas that hurt, and that can be really effective. You can put ice way on the back of your neck if you're having a tension headache. Getting good sleep is really important. We have another video about sleep problems that I'd recommend you check out, because good sleep hygiene, which is such a weird word to talk about with sleep, but good sleep hygiene can help people who suffer from headaches. If you know you have triggers like bright light or certain food, obviously you'll want to avoid those. I recommend avoiding caffeine, although some headache remedies do have caffeine in them. You want to make sure that you're maintaining sort of homeostasis in your body, not a lot of changes in routine. And I also recommend that people not smoke, because smoking causes constriction of the blood vessels, which is what triggers headaches. So lots of reasons to quit smoking. I know it's like the hardest time to try to quit, but it's really important that you quit smoking for several reasons. Other than that, you can talk with your medical team. You can take over-the-counter medications. Just clear it with your medical team. If you're on a chemotherapy that lowers your the cells that help you clot, like the platelets, you might want to avoid blood thinners like aspirin and even ibuprofen or naproxen, which can lead to bruising if you have low platelets. Other than that, most over-the-counter remedies can be taken, and if you're on a prescription medication, just let your medical team know what you're on, because they're going to want to check for interactions. I've covered a lot. Headaches are pretty common, and I've seen people really suffer from headaches when they start endocrine therapy, when they stop it, when they have sleep problems. So you're not alone, and there are lots of things we can do for you to help you and things you can do on your own. I hope this has been helpful. Visit Yerbba.com if you want to learn more about your treatment options. And if this video was helpful, click like and subscribe, and please feel free to drop a comment below and we'll respond to that as soon as we can.